Hello and welcome to the Centralina Area Agency on Aging Transportation Mini Series. We're happy to have you here today as we focus on this topic, and it's transportation for older adults, people with disabilities, and caregivers, and recognizing that transportation is a critical lifeline supporting independence. So we're really excited today to feature a guest speaker. We have Melissa Gray, who is with US Aging and who serves as the Assistant Director of the National Aging and Disability Transportation Center, which is sometimes referred to as the NADTC. And so this will kick off our transportation mini-series. Melissa, thank you so much for being here. We'll turn the floor over to you.
Thank you so much, Katie, and I'm happy to be here and just share a little bit of what I know regarding transportation options for older adults, people with disabilities, and caregivers. So, as Katie mentioned, my name is Melissa Gray, and I am work at US Aging, but US Aging is a partner with Easter Seals, and we co-administer the National Aging and Disability Transportation Center. So just a little bit about who we are. Our mission is to promote the availability of accessible transportation options that serve the needs of older adults, people with disabilities, caregivers, and communities. And we have some primary functions of what the center provides. That's technical assistance and training through our toll-free hotline, as well as you can reach our TA specialist via email. We put out a host of publications and resources, so I encourage you to go to our website, www.nadtc.org, to check out a lot of those resources. We do a lot with partnerships and coordination, primarily through our coordination campaign, as well as our diversity, equity, and inclusion initiative. And then finally, we provide community grants and coalitions, and we have an annual grant program every year where we provide funds to local programs that are promoting and developing accessible transportation options right there in their community. So I wanted to start today's talk or presentation with this quote from Elijah Cummings. And I really like this quote, and it sums up a lot. It says, "Our decisions about transportation determine much more than where roads or bridges or tunnels or rail lines will be built. They determine the connections and barriers that people will encounter in their daily lives, and thus how hard or easy it will be for people to get where and where they need and want to go." And this quote is especially true for older adults and people with disabilities, as they are a group that often face great barriers to accessing transportation. So accessing transportation for older adults and people with disabilities can be challenging, and there are many risk factors or impacts associated with them not being able to connect to transportation options in their community, or simply maybe the lack of transportation options available in their community. For example, some impacts include older adults who stop driving, take 15% fewer trips to doctor's appointments, 59 fewer trips to go shopping, 65% fewer social trips to visit family, religious activities, and other life-enhancing trips. We've also found that half of older non-drivers don't leave their house on any given day. So we know that social isolation is a huge issue among older adults and not being able to get out. And we saw that at a heightened level during the height of the pandemic. And so it's really important that transportation options are available to get older adults and people with disabilities to the places that they need and want to go. We also have found that 3.6 million Americans miss or delay non-emergency medical care because of the lack of transportation. So folks are missing getting to their doctor's appointments, critical care, whether it's cancer or dialysis, just because they simply can't get there. And this is also impacts to the healthcare system because of folks not getting there and having to be readmitted to hospital. So also an impact to not only older adults, but also healthcare. Another impact is only 10% of the Medicaid population uses NEMT. So that's non-emergency medical transportation, and representing about 1% of total Medicaid spending. And then finally, I wanted to share a statistic about family caregivers. 78% of family caregivers provide or arrange transportation. And if you are a caregiver viewing this today, you can attest to that. And they provide about 1.4 billion rides to older adults. And this was a statistic about 10 years ago. And I know that number has increased today. So I wanted to talk a little bit about human services transportation. I know many who may be viewing this video are with aging services organization, maybe centers for independent living, other types of disability organizations. So simply put, human services transportation are transportation services provided by or on behalf of a human services agency to supplement available transportation to meet the needs of a particular population, for instance, older adults and people with disabilities. They also provide access to agency services and meet basic needs, day-to-day mobility needs of transportation disadvantaged populations. And so overarchingly, the role of human services agencies is to assess the need for, one of their roles is to assess the need of transportation in a community and identify these transportation gaps and engage older adults and people with disabilities in these conversations about transportation. And that's something that I kind of want to put a pin in on, because a lot of times, yeah, agencies want to provide a service that they don't necessarily know what the person actually needs. And so engaging folks, including them in the conversation, is critical. So when we think about the scope of transportation being provided by human services agencies, we really should think about options and different ways to provide these rides and different ways to provide these options. And it's important that agencies and organizations specializing in serving older adults and people with disabilities, that they be actively engaged in transportation. We know that transportation is a social determinant of health. We've finally been able to get that stamp on transportation. People talk a lot about meals and healthcare and social activities, but also transportation is a critical link to get folks to these activities, to a congregate meal program, to a medical appointment. Without that transportation, it's really hard for individuals to live independently in their community. And that's what transportation impacts. It impacts independent living. It enables people to stay connected to family and to friends and to access other things like social and medical appointments, work, school. And it also brings people together. So these services are critically important to support what aging services professionals call aging in place, and those in the disability community, and puts emphasis on what living independently and fully engaged lives looks like. So on this slide, you'll see some examples of what we've often like to call a family or a network of transportation options. Options available in your community are likely to include some of these programs and services, but maybe not all of them. The basics we've found are public transit and paratransit, but not all communities have a public transit system. And if a person is fortunate enough to live in a community with public transit, all the better, because there are so many options to be able to use those systems. So this list is a diverse, individually specific group of transportation services, and it offers a lot of flexibility. But as I mentioned, not every community is able to offer all of these services. But again, a huge variety: volunteer services, transportation vouchers, driving, riding with friends and family, as I mentioned, public transit, medical transportation. And human services transportation encompasses a lot of these options, but it can be very diverse and hard to define at times. So when it comes to meeting the transportation needs of older adults and people with disabilities, it's really important to that the ties among all of these options and even more be seamless, and that people are able to choose one option or another, or a combination of options, depending on their circumstances and the services that they need to get to the places that they need to go. So this graphic, this particular slide, it shows the most frequent sources of information about transportation used by older adults and people with disabilities. And this was taken from our 2019 needs assessment survey of older adults, people with disabilities, and caregivers. And I'll be referencing that survey often during my talk. And what we found is that many rely on friends and family for information about transportation options. We also did another needs assessment, or a national survey, and it was our diversity, equity, and inclusion survey. And it revealed similar information that both diverse older adults and diverse younger adults with disabilities most often turn to friends and families and neighbors for information about transportation. So what do riders want? What do older adults and people with disabilities who are looking for alternative transportation options, what do they want? So many older adults and people with disabilities are often reluctant to give up their keys or convert to using public transit or other alternative transportation options because they don't feel that the options are falling in line with the things that they need. And so this list comes from our 2019 National Needs Assessment Survey. Um, Folks were telling us they want reliable rides that are going to get there when they need it, when they requested it. They also want safe rides where they know they are comfortable with, if it's a volunteer driver, they're comfortable with the driver, they have a relationship with the driver, or if it's a public transit option, that they know that the driver won't pull off before they're able to get into their seat at a safely before the bus pulls off. Folks are also looking for driver assistance. So many folks need door-to-door or door-through-door assistance getting into a vehicle or out of a vehicle, or some folks need assistance getting packages and groceries into their car or help into a doctor's office. And so looking for a little bit more escort assistance with a transportation. Courteous service. Who doesn't want courteous service? You don't have to be an older adult or a person with a disability to want to have courteous service. Public transit operators. Now there's a lot of training out there, training bus drivers and operators on how to engage with older adults, with a person with a disability, whatever the disability, if it's a visible or an invisible disability. If it's an older adult with dementia, we at the NADTC have publications and resources on driver training on how to engage with a person who is living with dementia. So these are just some things that folks are looking for. They want affordable trips, things that they can afford, easy to book and trip information. So we're seeing the technology wave is sweeping us fast and furious. And so we're seeing a lot more phone applications where older adults and people with disabilities can access on their smartphones to schedule rides, to follow rides, and to know and to be able to know when a ride is arriving to them. And then finally, family or companions who can ride with them. As I mentioned earlier with the assistance, a lot of caregivers are looking for ways where they can ride with their loved one to a doctor's appointment, just for the comfort of having a family member or a loved one there. And so these are just some of the things that people are saying that they want. Also, similarly, in our 2021 DEI survey, we found that among the top transportation, changes that both diverse older adults and diverse people with disabilities were asking for is they wanted to see more free or less expensive rides and better public transit. So again, those things are falling in line with this list. Again, our 2019 Needs Assessment Survey, and I reference that survey a lot. It's a lot of great information, and I encourage you to visit our website to see the results from that survey, as well as our 2021 National Survey. But from our 2019 survey, those results noted some top barriers to using transportation that older adults and people with disabilities reported. They said that transportation services are too expensive. I just mentioned that, folks are wanting free or less expensive rides. We see there are programs out there now that are having, ride caps and doing different things to make transportation more equitable and helping individuals from communities that may not have the resources to be able to pay top tier for certain transportation services. Another barrier, not enough services for people with disabilities. Again, one size does not fit all. Every disability is not the same. And often if you're meeting the needs of an older adult, that may not meet the needs of a person with a disability. And so as an agency, as an organization, as a service provider, you have to begin thinking from the perspective and the lens of a person from the individual basis and not from the collective often. Not enough public transportation options. I mentioned that just a minute ago. You'll find in many rural communities that transportation is limited or just non-existent. And so that's why alternative options, figuring out ways to find out what folks need in their community, whether it's a volunteer transportation program that can help them and assist them to get to the places that they need and want to go. transportation services are just difficult to access. I don't, people just don't know about them. I don't know how to find out about them. Where are they? Or I just can't get to them because of environmental barriers, whether it's sidewalks. I can't walk to a particular station or a transit station because of the walkability is just not there. And then finally, concerns about wait times, having to wait for rides, having to schedule rides far in advance to get to a particular place. Some additional ones, long distance, I mentioned rural communities. Often they're traveling further and spending a lot more time traveling to get to medical appointments than do people in urban settings. So that's also another barrier for folks that are in rural communities as well. So when it comes to providing transportation options for older adults and people with disabilities, it's helpful to know some of their top challenges or barriers. So the following, I pulled these from our needs assessment survey that we conducted in 2019. One, there is no single go-to information resource for alternative transportation options. And as I mentioned earlier, most turn to friends and family for help. And when I say no single, well, when they've said no single go-to information resource, it's just difficult to pin down one particular location or one particular agency that knows all of the information. And that's really difficult for an agency often to have or often to know. So you see a lot of coordination sometimes amongst in communities, among different agencies to try to piecemeal and figure out and to try to bring together all of the resources to be able to provide to individuals living in the community. So a function of a mobility manager is often a person that folks turn to for these resources. They're skilled and equipped to know what's going on in the community, what transportation options are available in the community. But again, you're looking at sometimes agencies that are not equipped with being able to advertise or market or do outreach to the community. And so a lot of times older adults and people with disabilities just don't know what's out there and what resources they can take advantage of. So that's one challenge. Another challenge, most believe finding alternative transportation will be difficult because they don't know where to start. They don't know, they're now at a place where they're at driving retirement, basically giving up their keys and not being able to drive anymore. All they've known is driving. And so they've never ridden a bus, they've never taken public transportation, or they've never taken advantage of any alternatives because they didn't have to. So now they're at this place. And so now they're feeling that it's going to be even more difficult because I don't know where to go. And because I never have access to these options, I'm now at this place where I have to figure out now, what can I do to get to the places I need to go. And then another challenge for folks expressed was that people living in rural communities or small towns say that their options are good. Like they're basically not a lot of people are saying that they have good options in their community. So if these options even do exist, they're often limited. As I mentioned, in rural communities, public transit is often not there. And then just the terrain of a lot of rural areas, very vast, very spread out, and it takes a long time to get to these places. So the number of older adults and people with disabilities who are seeking transportation services in communities nationwide, it continues to grow and grow and grow as our population of aging adults are continuing to grow. And so not having access to these transportation resources can lead to rescheduling, missed appointments, as I mentioned earlier, delayed care, missed or delayed medication use, and then providing these adequate transportation options can help to alleviate some of these risk factors. So I wanted to share a few challenges in their own words, and these are direct quotes from some folks that took our 2021 DEI survey. An older adult from Georgia in terms of transportation said, I want to go everywhere and I don't want to be limited. I mean, who doesn't want that? A younger adult from a disability from Kansas noted, I take county transit to the doctor and grocery shopping, but otherwise I'm not able to leave my home. I would get out more if I had the choice. And so this younger adult is just looking for options, just ways to get out and get to where they need to go. And then finally, an Ohio caregiver noted, I am the transportation to the grocery store, to doctor's appointment for my aunt and my brother. And it is an issue with gas prices, and I don't get a break. I change my schedule to meet theirs. And so now you hear from a caregiver who is dealing with not only economic issues and affordability with gas prices, but also the bandwidth that we see often many family caregivers are, working with or not working with at all. And there's some of the burden that they have to experience in being that transportation, that 78% and now probably higher percent of caregivers who are providing or arranging rides for their loved ones. And this is I'm nearing the end of my slides, but I do want to mention our long-standing partnership with the Elder Care Locator. The National Aging and Disability Transportation Center has been partnering with the Elder Care Locator, and that is a national call center. It is administered by U.S. Aging, funded by the Administration for Community Living. And that is a place where older adults from all over the country and persons with disabilities now with their disability information access line dial can call for information for in their local community. And that's what I love about the Elder Care Locator, is that they provide information to callers on things that are going on in their area. And so they'll localize that information, connect folks to their local area agency on aging or their local center for independent living or aging and disability resource center, ADRC, so they can connect them with transportation options and other services in the community. And so just wanted to highlight a couple of joint publications that we were able to do a few years back with the Elder Care Locator. Before you give up the keys. It's still a timeless, very tried and true resource that we promote from our center, and creating a roadmap for transportation independence. And now I'm speaking to those that may be viewing this this mini series. You're an older adult or a person with disability yourself, or someone approaching becoming an older adult. What I always like to emphasize is don't wait until the keys have to be put away to then start mapping out your transportation plan for the future. You're not going to immediately, when you can't drive anymore, have to stop going to the doctor or have to stop going to the grocery store or other places or connecting with family or friends. Your life will continue, and so should your transportation independence continue. So definitely check out that resource, as well as transportation options for older adults and people with disabilities. Two very great resources on our website, and you can download those as well. So I did want to end my time today with a few questions that you can begin to ask yourself as a aging services organization, a disability services organization, human services, and even an older adult or a person with disability that may be viewing this today. As a provider, in order to assist older adults and people with disabilities in overcoming transportation barriers, you definitely need to look for ways to equip yourself and your organization with as much information as possible. So asking yourself the question, have I identified the most relevant and most widely available transportation services in my community? If you are not a transportation provider yourself, and even if you are a provider, are there other organizations and agencies that you could be partnering with? Also, have I gotten to know local transportation options in my community? And then finally, am I familiar with travel training and transportation planning options? These are just a few questions. It's not is not an exhaustive list, but just a few things that you can begin asking yourself to better equip yourself of what's available in your community to provide older adults and people with disabilities regarding their transportation. And if you are yourself an older adult or a person with disabilities, these questions you can also ask yourself. And if the answer is no, then definitely connect to your local organizations, your local area agency on aging, your local SIL, folks that may have this information. Talk to a mobility manager and get you connected to the services that you need. So this is where you can find us. We have as I mentioned, our website, www.nedtc.org. You can scan this QR code on the screen, and it will take you directly to our website. We have a monthly e-newsletter, and we are on the social media handles, and so you can find us there. So please connect with us. We'd love to connect with you. And if you need to and want to connect with me, here's my information. And I would be delighted to hear from you. You can definitely call me or any of my colleagues at the National Aging and Disability Transportation Center. We would be delighted to hear from you. So thank you so much for your time today.
Wonderful. Thank you so much, Melissa, for that overview of important considerations related to transportation for older adults and people with disabilities. That was just wonderful information. And those last few slides that we have here, just in addition to the national resources that you mentioned, we wanted to share some information about resources for North Carolina specifically. So we do have our North Carolina Association for Area Agencies on Aging. We also have a transportation directory through the North Carolina Division of Aging and Adult Services. So people can find all those transportation providers who are receiving federal or state funding. And then in addition, we've got our North Carolina Department of Transportation and the North Carolina Public Transportation Association, where you can find transportation resources. And then as we close, of course, we're the Central Carolina Area Agency on Aging. So you certainly can visit our website as well to find out about specific transportation resources in our region. We have a regional transportation guide that has information about different options county by county. And then, of course, we encourage you to come back and check out the transportation mini series. So this is one recording of several. So please do come back and find out more about transportation considerations for older adults and people with disabilities. So thanks again so much, Melissa. We really appreciate having you here and your expertise. And thank you all for tuning in.